What can you do to protect yourself from COVID-19, which is a specific strain of the coronavirus?
I serve a population of patients who have chronic illnesses, and this question I've been answering a lot lately, as I'm sure you can imagine. The most important two factors are containment and mitigation. These are the guiding principles to what's
Okay.
involved with the coronavirus or COVID-19. So containment is about reducing the transmission of COVID-19 so the curve of prevalence flattens. In other words, instead of using those fancy words, the number of new cases diminishes, so the goal becomes 0 new cases, and eventually the COVID-19 hopefully will diminish and go away. And mitigation is reducing those symptoms if you do get the coronavirus, so that you are asymptomatic or you have mild to moderate symptoms, not severe. Fortunately, 4 out of 5 or 80% of the population who does get the coronavirus has the mild to moderate form.
How do you reduce the risk of getting the virus and reduce the symptoms if you do get it?
According to the CDC, washing your hands with soap and water for at least 20 seconds is a great way because it helps denature the envelope around the virus. So basically, it's helping to kill the virus. And we should be washing our hands for 20 seconds, even if there weren't a virus around. So this is a great message, a great public health message anyway. Don't touch your eyes, nose, and mouth. And social distancing, meaning keeping 6 feet away from other people and not congregating in large groups, because that's how it spreads rapidly. Also, get in the habit of cleaning and disinfecting surfaces you touch or other people touch. And for more information, you can go to cdc.gov.
Is there anything we can do beyond, what can we do?
That's a great question. This is what I call the 4 pillars of lifestyle modification, which include diet, exercise, stress management, and sleep. The goal is to have an anti-inflammatory diet that will strengthen your immune system, a whole food plant-based diet that's nutrient dense, or what I call the LIFE diet. The LIFE diet stands for low inflammatory food everyday diet. The Lancet study from Wuhan, China found that inflammation and weakened immune system were central to determining how people will do on entering the hospital. So whether they'll die or they won't depends on how their immune system is doing and how the inflammation is doing. What is found with the LIFE diet in my practice experience is that people have white blood cells that are on the low end of the scale, between 2.5 to 4.5, rather than in the middle or on the upper range between 6 to 10.5. So this is counterintuitive. You would think that you'd want your immune system to have higher white blood cells. But if you had higher white blood cells, then the white blood cells, they go from, say, 6 or 8 to 20,000 or 24,000. And that's when the white blood cells start attacking your healthy tissue, when they're overzealous. However, people who have white blood cells that are in the lower range and in a healthy lower range, around 3.5, when they get sick, my patients have white blood cells that stay within the range. They go up to about 8 to 9. So they never even break the normal range. So you don't want too many white blood cells all at once. This means that if they do get the coronavirus, then the response will be more likely targeted instead of disproportionate large response that starts killing the virus, but also the healthy tissues in the lungs, which causes inflammation and fluid buildup in the lungs. And the fluid buildup is horrible because even if you're on a ventilator, if you have fluid, you can't get air in the lungs.
Yeah.
So you want to focus in on things like fruits, vegetables, and legumes. They're very important. With vegetables, the focus should be on dark green leafy vegetables, such as spinach, bok choy, kale, broccoli, and cauliflower, as well as mushrooms. For fruits, apples have shown to play an important role in lung health. All types
Apple
of
a day, right?
Yeah, apple a day. I say an apple a day keeps me okay, because if I said that it keeps the doctor away, I wouldn't be able to be next to myself. Oh, that would be social distancing, and that's what we want. So I have to social distance from myself, so I'll stand 6 feet from the mirror.
So stress is another factor. What effect exactly does stress have on us?
Well, the first thing we should do to avoid stress is not to panic. People always go into panic mode, and it's very hard. So we want to be vigilant. We don't want to panic. We want to do things.
Right.
When you stress, your body releases cortisone, or internal steroids, that actually weaken the immune system. That increases your risk for COVID-19 and the severity of the disease. So if you reduce the stress with a whole food plant-based diet, exercise, yoga, meditation. All of these things help. Even adaptogens, which are supplements, but adaptogens are herbs that can help you reduce stress as well.
Talk to me about sleep.
Well, getting enough sleep is important for everything. Getting quality sleep is important all the time. And it's not about how many hours, it's about the quality of the sleep. So if you're in bed for 9 hours, but you're not really sleeping, that's not quality sleep. But if you're in bed for 7 hours and you're sleeping really well, then that's quality sleep. And you want that for memory. You want that for functioning. You want that for the frontal cortex so that you can have recall. And you want it for the immune system so that we work on avoiding the COVID-19 or at least making the symptoms asymptomatic or mild.
Right.
And in Wuhan, China, a 29-year-old doctor who was working long hours died of COVID-19. And that really scared the Chinese because it said, okay, it can affect a healthy person. However, she was probably very stressed out because remember, we know that she was working long hours. And this is sort of, I know this from residency. The long hours that I was working caused a lot of stress and I didn't eat well and sleeping was such a small priority and I didn't exercise a lot of the time. So I was really stressed out. I wasn't eating well. I mean, this is basically the 4 pillars not being observed, not being followed, and then ultimately having the problem, which is the worst possible scenario, where the woman's heart stopped while she was on a ventilator. Yeah, it's so terrible.
What if I get a moderate or bad case of the virus?
Well, if you get a moderate or bad case of the virus, just know that right now, there are no medications that are approved to treat the virus. So it's not that you're looking for medications. What you're looking for is supportive care. And supportive care means things like hydration, eating when you're hungry, focusing on foods with fluids in them, such as fruits and vegetables, a restorative soup with dark leafy greens as the centerpiece. But in the soup, you don't want high salt because that causes dehydration. I always say that you have a bank account and it's the blood cells. You only have a certain amount of blood cells. And so you only have a limited bank account. Most of us have very limited bank accounts and we can put our resources to one thing or another, but we can't do all of it at once necessarily and do a great job. So if you don't eat, but you take in liquids, fluids that help hydrate really well, and that could be a smoothie, which a vegetable or fruit smoothie, that could be vegetables, could be fruits, could be water, could be a combination of them. But if you take in some fluids that help hydrate you, this is going to make a tremendous difference. And if you're not eating much food, then that blood supply can help go other areas besides digestion. And that makes a big difference. There are some instances you might have to go to the hospital where if you have difficulty breathing, persistent pain or pressure in your chest, new confusion or inability to get up, bluish lips or face, you might want to call 911 or you might just want to go to the hospital. I would go to the hospital if you can do it, but if you go to the hospital, you should be in bad shape because you don't want to go to the hospital if you're not, because you don't want to pick up any viruses and you don't want to spread the virus to anybody else.
Right.
So to sum up, chronic diseases and not managing those 4 pillars are risk factors for dying from COVID-19. And you can improve or reverse the chronic diseases as well as strengthen your immune system and reduce the inflammation through a plant-rich, dark leafy green vegetable diet like the Life Diet. And I can also emphasize that we have control. And this is wonderful. Even though there are no medications, we have control to make a big difference, to make sure that we get the asymptomatic or the mild, not the severe. And that we may have a mild temperature, but that's not a big deal. So that's what we want to strive for, or we want to strive for not having it at all. But if we're going to get it, we want the mild form.
So, Doc, if you're going to use a fever-reducing medication, which we don't recommend unless it's really high fever, are there ones to avoid or are there ones that are a better choice?
Actually, there are. You want to try to avoid NSAIDs, which are non-steroidal anti-inflammatory drugs. And these are over-the-counter drugs such as ibuprofen, better known as Advil, naproxen, and even aspirin. But there can be prescription drugs such as diclofenac because they suppress the immune system. thus making it more difficult for the immune system to fight the coronavirus or COVID-19. This suppression of the immune system occurs by an anti-inflammatory effect that has a mechanism of action that's different and detrimental compared to the favorable effects of a whole food plant-based diet, such as the Life diet, with its anti-inflammatory effects. This is very important to recognize, that it's not the same effect as a dietary approach. The medication to use if you want to reduce fever is acetaminophen, better known as Tylenol. Yes, it doesn't always work for some people. For some people, NSAIDs work better. For some people, Tylenol works better. But unfortunately, Tylenol is what you need to use. You have one choice here. And that's because Tylenol doesn't have anti-inflammatory effects. Thus, it's not interfering with the immune system. So it's not going to suppress the immune system so we can't fight off COVID-19. And this is supported by the health minister of France, which just mentioned that this came out, that Tylenol should be used and the NSAIDs non-steroidals should not be used.
I have one big question I need to ask, because you talked about containment. How long is this going to take, Doc?
That's a great question. I don't know that anybody can answer that question. It depends. We're hoping that warm weather will make a big difference. But if it goes anywhere like it happened in China, it could go on for several months. The outside could be as much as September, but we don't know. But the better you do with the 4 pillars and the better you do with containment of staying away from each other, the faster this is going to change and the faster the curve is going to flatten. So if we follow through with not going out right now, not going to bars, not going to restaurants as much, you can always order in from a restaurant, but not going out to restaurants very much, staying away from people about 6 feet away, avoiding people who are coughing or sneezing. I mean, this is all very important. Not going to sporting events. Of course, they've canceled a lot of sporting events, but this is not an excuse to go meet somebody in their house or something like that. You really want to stay apart most of the time. And that doesn't mean you have to have social isolation. You can do it through the computer. You can do it through prompters. You can look and talk to people on the computer, on the phone, whatever it is, FaceTime. You don't have to be alone. Don't isolate yourself where you feel like you're alone and you're depressed. Make sure you're in contact with people, but it doesn't mean you have to be face to face with them.